This is a sterile dressing change for your fundamentals practicum return. You would introduce yourself and explain the procedure to the patient, assess location, size, and condition of the client's current dressing, which you can see here, assess the client's comfort level and address any pain that they may have, select and prepare a clean, dry, flat working surface above your waist, properly remove and dispose of the soil, dressing, and inspect the wound. As you can see here, she has pulled out the red biohazard bag to discard the dirty wound dressing. She'll remove the dressing with a gloved hand, one layer at a time, assessing the dressing for drainage, describing the condition.
So there is some serous drainage located on the dressing, and the incision seems to be intact and clean. There are 5 staples located to the midline and a Penrose drain to the right, to the patient's right of that incision.
Perfect. She'll remove those gloves and perform hand hygiene after she's removed the dressing. And then she'll go on to prepare her sterile supplies, opening the package without contamination, grasping and positioning the drape correctly for the procedure, donning her sterile gloves, and then setting up her sterile field.
The incision is about 3 inches in size.
She's maintaining sterility as she sets up her sterile field. She will pour her saline without contaminating. She's going to soak some gauze for cleaning and leave some dry to dry the wound prior to redressing. Now she'll clean the wound and drain if there's one present, and there is, using the correct technique, which is going to be clean to dirty. Making sure to use that non-dominant hand to pick up those clean. Perfect. Now she will dress the wound after drying and secure the dressing, making sure that she uses the correct materials and correctly applies the clean dressing. He'll make sure to state the correct documentation of the wound and the cleaning, which includes the location, size, appearance, number of sutures or staples, odor, color, how the patient tolerated the procedure, her name, and date and time.
Patient tolerated the procedure well. There was a midline 3-inch incision to the patient's abdomen with a right-sided Penrose drain that were both intact. The incision was clean, dry, and intact upon appearance, and no edema noted. There were 5 staples to the incision, and there was no odor to the drainage. The drainage was serous drainage, and again, the patient tolerated the procedure well.